Okay, now we are recording. It is 11 o'clock in the morning here in Denver area on 10/20, week 4 for 105, OAHP 105, medical terminology. So here's what I want to go over. It's not imperative that you're watching this, but it is available, of course. I'm going to post this on the YouTube as well, just so it has like some longevity to it, and we'll take it down later or something. But we're going through week 4 stuff, and I'm going to give you some hints on how to do things like the discussion board and the other things that are due this week, which, I mean, today's Wednesday, so they're actually due this evening. But we have a little leeway on that. Lab 4 case study, and then week 4 case study, and week 4 assignment, and then week 4 quiz. So most of you are doing really good on the discussions. We need to expand. Look at the discussion. So this discussion here, we'll look at this one first. I'm looking at my other computer here, and I'm looking at you guys. So we have two things going on at once. This is the discussion on the colonoscopy. The colonoscopy asks, okay, respond to at least 2 of your fellow students by Sunday. And that means expand upon it. So go through and let's look at what you would have to do to prepare for a colonoscopy. How would you explain that to someone? What should they do after a colonoscopy? What happens during a colonoscopy? Okay, those are good things. And look for the vocabulary. Now, in the discussions, a couple of people I responded to already. I did look around there. I put some kind of hints for that kind of stuff. I just couldn't figure out anywhere to put it. So now, so your friend Jessica calls to tell you she was sent by her family physician and recommended she have a colonoscopy. Jessica tells you she doesn't know what a colonoscopy is, and she was too afraid to ask the doctor, which happens all the time. So they're going to ask you as the friend of the family, or as the assistant person, or your cousin, or whatever, your neighbor or something like that. They're going to ask you what it is, and they're going to rely on you to understand what these words mean. They're going to say, what is a polyp, or what is a fistula, or what is a Crohn's disease? What's going on with me, man? I have something wrong. Okay, she asked you to explain it to her. So explain what you would tell her. Let's work on what is a colonoscopy? How is it done? What do you need to do to prepare? What happens during it? How long it takes? What it entails? Is it painful? What is recovery like? When can you eat again? These are all good questions to ask and comment on. Got my morning tea here, guys. It's good. So describe your knowledge of medical terminology, help you determine what to say. Your medical terminology now is basically, I'm learning medical terminology. That should be one simple sentence for everything. The more you know, the better. So let's add some vocabulary. I did add a vocabulary on some conditions. So like say, hey, if Jessica turns out to have Crohn's disease, this is what they may say: ulcerative colitis, irritable bowel syndrome, diverticulitis, diverticulosis, diverticuli, all these different words that we can use. Is there going to be a problem with the different parts of the colon? What are they? How far does the video go? How far does the camera go? What else can the video see? Here's some other hints: Peyer's patches, the flexures. Name the flexures. There's a splenic and hepatic, and there's a transverse, and there's a not transverse flexure. There's a transverse colon, a ascending colon. There's a cecum. There's a sigmoid colon. There's a rectum. There's all this kind of stuff. So start adding in those vocabulary points. It was really easy for me to find this stuff. I just basically go online, read about how it's done, have some questions. What would you what questions would you have? Think of 3 questions you would have if you were told you're going to get your grandma was getting a colonoscopy, and like they want you to explain it to her and say, oh gosh, I better have all the questions ready because grandma's going to put me on the spot. Answer those questions. That's how you do it. Everything else is looking good. Some of you aren't responding to each other as much as we'd like, but some of you are doing amazing work, and I love that. So we're doing really well with those. Let's go on to our next point. Where am I here? Go back to grids. We're going to look at the next thing. So that's discussion board. Okay, discussion boards. Expand upon those. That'll give you the hint for all of this stuff. I'm going to put this in my, I'll record it and then send it to you guys, and then it'll have the idea of, I'm basically giving you the hints. Okay, let's go to the next thing we have to do, which is the lab for week 4. Few of you have already done it. It looks really good. Most of you have done it. So when you're doing these labs and stuff, make sure that the answers are showing up on your answer sheet, because some of you are turning in the the worksheet with no answers. And so I have to give you like a 1 point or 0 points or something like that and go from there. So this is Henry Walker, Morgan Butterfield, blah, blah, blah. Okay, let's look this up. See what it is. Going to open up at the same place. It is, you monster. Ah, here we go. Here we are. Okay, so 1 day old Emmeline Jones was seen in the nursery to be evaluated with cleft palate and lip. So look up what a cleft palate is. Cleft means to be split, right? Cleft palate. There's a soft palate and a hard palate. There's also lip. That's this, right? Obviously. The immediate concern, however, is cyanotic. Okay, that's an incorrect hyphen. It is cyanotic. That's just cyanosis is a word. It doesn't have to have that hyphen in there, okay? And dehydrated. I don't know why they put that in there. Maybe to help you understand the word. The mother says that the baby would not take any formula, was not introduced to it with a modified bottle because they have a cleft lip. So look up what a cleft lip is. Okay, that'll give you some information. An attempt to insert the feeding tube was unsuccessful. X-ray showed an air-filled pouch in rehydrated. An air-filled pouch in rehydrated. An emergency esophagus gastronomy is performed. So it probably had some kind of atresia, which is what it's called. Given the diagnosis of oral and probably nasal cavity, because that's where it goes, right? Esophageal gastronomy means that a new blank has been formed between the esophagus and the stomach, a new pouch, basically. Esophageal atresia means there's no opening between the esophagus and the stomach. Okay, that's what atresia is, as we knew. So you have chelioplasty. So chelio has to do this. Okay, and chelio. So look those up. Surgery needs to be performed like whether it needs to be. Okay, these are good. These are easy. So you can do these ones. Fill them out. So do me a favor. Do not send me a blank page with 5 answers on it. That doesn't help me because I need to see this. The labs are different and I need to see the actual worksheet. Put them in there and highlight them for me. And then that way you have a copy and I have a copy and we can discuss, how right or wrong your answers are. Because not having the answers on the worksheet gets you 0 points. And then I'll take points off if you don't give me the case study too. Give me the case study so I have the information so I can look it up and see them in context, because I'm looking through dozens of these and it's difficult to keep up with some of them sometimes. Number 2, Henry Walker, a 66-year-old retired professor who has a CKD due to DM. CKD due to DM, diabetes mellitus. His initial testing, GFR protein urea. So you got to look up glomerular filtration rate and protein urea. There's another hyphen that does not need to be there. Over a 5-year period, progressive CKD is stage 5, cholecystokinin disease. Look that one up. He's been on HD for 1 year. Waiting for a list for a new kidney. GFR stands. Okay, there we go. Glomerular filtration rate, CKD, known as type of renal dialysis. It cleanses the blood and shutting it off from the body through blah 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 blah. Those are good ones. Those are easy to look up. So you can look that kind of stuff up. You'll have some good vocabulary on those, and that's helpful. Okay, dropped an apple. If the donor kidney is found, he will undergo look up the actual technical term for it. Case study 3, Morgan. Waitress at chain restaurant help pay for school, although she's been feeling under the weather for a few days. She has a busy schedule of waitressing 9 to 10 a day. However, horribly sore throat and difficulty breathing. While visiting your doctor, he sees an inspiratory stridor. That's what stridor is, okay? And tachypnea. Tachypnea, fast, were noted on her chart. So tachy means fast, okay? Brady means slow. Pnea, remember pnea, pneuma, okay? That has to do with lungs. So it was tachycardia, that'd be a fast heartbeat, right? And bradycardia would be a slow heartbeat. Well, visiting your doctor inspiration, blah, blah, blah. This is to describe abnormal sound, rate of breathing, especially more as epiglottitis. Okay, it would be better if we put someone was a singer or something like that, or a vocalist, the same thing, or they were yodeling, or they were at a concert and they were screaming a lot. That would give you epiglottitis. She worried that Morgan may need a tracheostomy if the image gets worse and swelling closes her airway. Well, yeah, that's possible. Okay, there's four, what, 2, 3, 4 questions, 5 questions on there. Very easy. What is the term for me? Is difficulty? Difficulty. Hypo, lower, right? Oxemia means low oxygen, right? Aphonia, you can't hear. So we're speaking through a phone. Okay, you're not able to speak. Okay, dyspnea, there it is again, and eupnea. You got to look up eupnea. Okay, contains a high pitch as a stridor or a rales, rhonchi. Those. So there's some terms that you have when you're listening to lung sounds: stridor, wheezing, rales, rhonchi are some of the main ones. It sounds like bubbling and crackling and crackles. Crackles is actually one of them too. Abnormal rapid breathing. We talked about that one. Inflammation of the epiglottis. Well, that's easy. It's up there. Oh, so these are nice and easy, man. You guys got this one. This is going to be an easy one. So don't be afraid to just get it done and turn it in. It should take you no more than 20 minutes to do this whole one and get your good 100 points or whatever the heck it is. I don't know, 50 points, something like that. So that's the lab. That was actually really, I like that one. That was a better built than most of the other labs. I don't like them usually. They're not as useful. Let's go to the next thing. So that was week 4 lab. Week 4 assignment, open a new tab, and then we're going to look at week 4 quiz. And that's all that's due for week 4, just like every other week. Okay, so I did post the video already where I went through the vocabulary stuff in the book and helped you with those. This is kind of like to help you guys with this kind of stuff. I'm going to look at like some grades real quick here. There's only 15 of you guys in the class, which is more manageable, but we have multiple classes we're dealing with. Majority of you are kicking butt and taking names, and I love it. And your answers are on point, and you're just nailing everything. Some of you are a little bit on the struggle bus when it comes to just expanding on what you need to say. I know it seems like BS, and you just want to get through the class, and you just want to hurry up and write this stuff. And I do appreciate when you're putting the meat and potatoes in for me, not all the other fluff junk. Okay, I don't want the garnish and the gravy and all that stuff. I want meat potatoes. I want meat, actually. Tell me what it is. Don't add to it. Okay, I'm going to turn that off for a second. Sorry about that. I will not be taking those calls today because I'm working with this stuff. For assignment, let's look at the assignment. Okay, chapter 5, 6, and 11 worksheet. Now, 5, 6, and 11 have to do with, what are we looking at here? Okay, gastrointestinal system. That's when I did the video on. Okay, I did the other one. Where'd it go? I did the other one on, where did it go? It's only 3 pages. Okay, wait a minute. What? Chapter 5. Okay, so it gives you all of them in one thing. Okay, it's mostly gastrointestinal. Easy peasy. Okay. Okay, so you guys have done good on this one. Please, again, with this one, make sure you're doing stuff on the sheet itself. I know it's harder if you're on your phone and things like that, or on a tablet, but let's see what we can do. Please work with me on that one because it's harder for me to grade them. It takes me longer, and I know you guys are getting a lot of stuff. So most of y'all are just, like I said, knocking it out of the park. This seems to be an easy class for you, and I'm really happy with that. That's a good thing, and you guys are doing well. I'll be posting some of those today, so you guys will know how great you're doing. You know what I mean? So let's say after having a viewing of the large intestine, the colon, the patient needed a removal of a polypectomy. Okay, the patient was tested for an inflammation of the liver, hepatitis. Remember, HEPA means filter, and hepatitis, itis is inflammation of that. Yellowing of the skin and the sclera. Okay, this, and no kidding, guys. Obviously, this is a yellow highlighter. This is highlighter right there. Okay, this is a yellow highlighter, and a yellow highlighter. If you take this, you mark it. Like if you color the whites of your eyes, it would look exactly like it was done from this. Same way with the skin. Imagine like you took your skin and just underneath it was like this yellow tinge. It's weird. You'll know it when you see it. You may doubt it when you first see it. You're like, oh, something seems wrong. It's weird. But you'll see this like yellowy color to their skin. And that's a sign of jaundice, which is a backup of the liver not dealing with the bilirubin and biliverdin stuff is building up in the skin, and that shows up as yellow. Okay, jaundiced. Patient protrusion of a loop of the intestine into the inguinal canal. inguinal. Okay, so remember, inguinal is the, let's see if this will work. This guy, yeah, here we go. So here's the inguinal area right here. Okay, oh, yeah, come on. There's the inguinal area right there. There's a little loop right here. Okay, and it's called the spermatic cord for a male comes through that and down into the scrotum. And this area here is where you get an inguinal hernia. Females tend to get abdominal hernias. Males tend to get inguinal hernias, okay, because we have an opening there and females don't. Okay. Suture repair of the hernia, suturing of the hernia. I usually call it hernia surgery, but let's see what it says. It'll have some kind of like technical name, right? Patient impairment of esophageal peristalsis was diagnosed. The patient's parent. Okay. Looks like there should be other pages, but there's not. There's only 3 pages of this one. Well, take it and run. Take it and run and do your thing. You know, these are good. This is all just digestive stuff. It doesn't look like there's anything else in here that is hard to do. Very simple to do. Okay, chapter 5. This is chapter 5, 6, and 11, but I don't see chapter 6 and 11. 11, remember, that's oncology. Okay, and I can't remember what chapter 6 was off the top of my head. I just did a video on it too. Did a whole thing. So watch those videos. If you need to, put them on, like down in this little corner right here in your screen will be a little gear on YouTube, and you can pick the speed and pick 1.25 and just listen to it, or 1.5 and just listen to it. Run it through first. It'll take you like 10, 12 minutes. I think it's like a half an hour I spent on each one, or 40 minutes, something like that. And that'll give you an idea of what's going on in the class. The more you hear this stuff, the better. So the more you hear and watch, say, medical shows or watch some medical terminology things, and then like pick out the words that you know, because I'm telling you, you got from what you knew 4 weeks ago and what you know now is a world of difference. You're gonna start picking up a lot of weird different names. Okay, so for example, I had a patient who came in who was taking, she's a young female who is taking a medicine for acne. Okay, which was I think it was called shoot, I can't remember what it was called. Shoot, I can't remember. Let me look it real quick. I'll tell you. So she was taking a medicine for acne, and she started having some side effects, which she was like, that's really weird to have side effects from Accutane. There we go. So she's taking Accutane, and her side effect was seizures. Seizures, what the heck? So they told their doctor, and the doctor said, no, it's not possible. You can't be having that, even though it is one of the listed side effects of the medication. The side effects of medication are supposed to be reported, but they often aren't. Almost 99% of the time they aren't, because to report a problem with a medicine is like 70 pages. It takes you a couple hours. You got to look for all kinds of stuff. You got to find out what the lot number was, who the manufacturer was, all this kind of stuff. And you might not know, because where did they get the medicine from, which doctor they go to, which doctor they come to for the thing like that. It's very hard to do. And many times they just poo-poo the ideas of being symptomatic. So seizure, after the seizure, she's very fatigued, which is called post-ictal. Okay, ictus is the term for seizures. Anyway, so whatever. Anyway, let's go and drop that one. Let's go to week 4 quiz. Week 4 quiz, chapter 5, 6, and 11. Okay, You have unlimited attempts? Okay, so I'm looking at the quiz. You have unlimited attempts according to this, which means if you want to take it twice or 3 times, you can, and it will take the highest score. Multiple attempts, score kept highest. Okay, here's what we got. Graded quiz, points 100. Shuffle answers, no. There's no time limit. You leave it up for months. Multiple attempts, yes. How many? Unlimited. Scores to keep the highest. View responses, always good. This way you get to see your answers more. Now you can also look this stuff up in the back of the book. All the stuff is in there, but that's a good way to review for yourself. And the more you do that kind of review and just searchy, the better it is. Okay. Show correct answers. No, I don't know why it doesn't do that. They should do that. One question at a time. Yes. Lock answers after answering. Yes. Oh, okay. Let's preview that sucker. Let's see what it is. Once you submit the answers, let's go from there. It's only been 20 minutes. It's just me, which usual. Peptic ulcer. Okay, synonym. Synonym. What does a synonym mean? A synonym is a name that is the same as another one, right? So decubitus ulcer, look up what that is. Decubitus, okay, remember like bed sores and decubitus ulcers are the same thing, so maybe not that. Gastric ulcers in the stomach, diaphragmatocele. Diaphragm atocele. Okay, seal means to pull through, right? So there's some kind of like rupture there. Diaphragmatocele could also be like hiatal hernia. Okay, you can look up hiatal hernia, which has to do with the diaphragm. We'll talk about that. I think I'm talking about it. GERD, gastroesophageal reflux disease. Okay, I'm not going to give you the answers on this one. You guys can do them. Okay, yeah, leave it blank, whatever. Okay, next. Inguinal hernia is same as a femoral hernia. Well, we just went over that, so you can go back a little bit. And inguinal hernia is for boys, and males can get either one, but generally females only get the femoral hernia regularly, or abdominal hernia. Whoops, cancel. Cheilitis in the cecum. Well, that would be cecumitis, wouldn't it? You got to look up some of the terms there. So cheilitis, right, usually happens here in the corners. Was the abdominal group of kidneys, polyuria, what is a group of symptoms? Well, okay. So it really could be a lot of these. Nephrotosis. No, ptosis means to sag, or like this is like ptosis, like this. Nephrosis, condition of the nephron. Nephritis, inflammation of the nephron, possibly. Pyelonephritis has to do with a couple different parts. So you have to find out the difference between really those two. Okay. Yes. I'm not doing any answers on this. So term for blood in the urine. We talk about that in the urinary. Oh, that's the other chapter. Chapter 6 is urinary. So we talk about that in there because there's the kidneys, or the ureters, the bladder, and the urethra. And when you have things that are normal in blood and abnormal in blood, that's in your urine. The normal in your urine is going to be water, salt, some filtrates like acids. You may have sometimes some cloudiness depending on what you've eaten. If you eat beets, you're going to have a redness to it. You're going to sometimes change color with different things, change the scent with different foods that you eat. However, things you should not have in your blood would be, in your urine, sorry, would be pus, which would be pyuria, or blood, hematuria, or sugar, which is glucosuria, or I can't think of any other urias off the top of my head. That's the main ones anyway. Okay. Abruptly stop function, acute renal failure. Maybe they should anyway. ARF, acute renal failure. Now I'm not real hip on using those because some of your acronyms and some of your initials for things are going to change depending on where you're working. It can change a lot. And I told a story about that in another video you can watch. Abnormal narrowing of the windpipe. Well, what is, okay. We talked about stridor. Clubbing has to do with the fingers. Clubbing is when you go out on a Saturday night. Okay. Tracheostenosis or tracheomalacia. Look up tracheomalacia, but that's not the answer. Anyway. Okay, number 8, substance that prevents the sacs at the ends of the bronchioles from collapsing. Good to look up. Okay, so we make mucus in those, and we also make surfactant. Cilia are those little guys that move things across the surface, right? Atelectasis, look up that one too. Squeezing down. TB, to be continued. No. So TB used to be called, you get cachexic. Okay, cachexia, which is a wasting of all the muscles, right? But it was also called consumption, and it was also called scrofula. Okay, these are old terms for that condition, which was rampant in the 1800s here in the United States. Still a problem, and millions of people die every year from TB, more than any of the other things that we know. TB is you get a tuberculin injection in your arm. They check for TB, and it's a very common thing. And if you have a positive, which means a red flash around it, they'll send you to get an x-ray of your lungs. Okay, so you can look that one up there. Scrofula is the old days. I think it's wow. Okay, the chest cavity inside, thoraco something. Okay, so there we go. That's basically everything for everything here. So some of you guys, it looks like, has missed. I'll contact some of you because I'm missing a couple of things from that I can't see it well. Okay, or it didn't load well enough, not in the discussions. Discussions okay. I'd like to see some of those scores go up. So make sure that you're talking to other people. And that can include me, or just make a statement. It doesn't have to be to anyone else. You can make a statement and maybe put your post into 2 pieces. Okay, that's not a problem either. So let's see. I'll go through those. Looks like only a couple people for the lab. I'm looking for more labs. I'll contact you guys today. Week 4 lab's looking really good. I got 2 people that have turned week 3 lab stuff in, but I haven't gone over it yet because it's either blank or something. Let me see. Is it blank? Let's see what we got here. Lab and case studies. Looking up stuff. Saving it as a PDF is the best way to go, by the way. Okay, so I'm looking at this one here. Hey, wait, no, okay, someone actually did it. So if I sent you a note and said, hey, turn it in, man, because I haven't seen anything, let me know so I can make sure and recheck your score, because I want to make sure you guys are getting the most bang for your buck. Because some of you have like turned in half of it. I was like, hey, I'm gonna give you 50% because there's a whole section missing. Go back and hunt down that section, turn it in, contact me and say, hey, I turned it in. Now I know with the midterm, I'm looking through some of those already with that and going through and making sure that everybody's cool and groovy with that, because there was some questions which we've seen before that have correct answers, but you guys put the correct answer, but it marked it wrong for some reason. And that drives me nuts. It's really a pain in my tuchus. Midterm, here we go. Most of you guys have really done well on this midterm. A couple people, wow, slapped it down. A few of you guys had some trouble, and it looks like we're only missing it from 1 person. So this is good news. That's a good way to really keep your score up, because it is, 30% of your grade. So remember, guys, discussion, 10% of grade every single week. Get it to me by the Sunday, because that's when I really check on things. So always after Sunday, like last night, I was going through and looking at week 3 because I wanted to make sure that everybody had a chance to respond. So I go through and I can give you guys a score. Now, week 4, I'm not going to give you a score yet. I'm going to start answering them and talking to you guys. And then after that, usually I chime in or whatever and leave responses too, because I want to show that I'm one looking, and 2, give you some hints on how to answer the rest of the questions. And when you do that, make sure that you're talking to 2 other people. It doesn't have to be specific. You don't have to be like, hey, John, I don't care who it is. You can do that. That's good, because it doesn't really show that way to me. It shows at me that there's at least 2 responses, because I look at yours individually. But go ahead and do that. If you find something in someone else's and you respond to it, great. Love it, love it, love it. Expand on those. Use some vocabulary, okay? Labs, 30% of your grade. That's a big chunk. And it's like most of you, wow. Okay, the majority of you. Okay, this is out of 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. 12 out of 15 have 100% in that one already. And there's like a couple that just missed a couple points here and there, probably because it was late, or maybe you're missing something. I don't know. No big deal. It's like we're talking 97%. You're still killing. And 1, we're looking for some other stuff to get. Assignments, 30% of your grade. 90s, 100s, 70s, 80s, 90s. Yeah, we're looking good on those. Quizzes and exams are kind of all over the freaking place, but that's normal for quizzes and exams. But you guys do get, remember, multiple choices, as many as you want. And when you turn in the last one, that's when you get your score. Not the last one, the highest score. So let's say you did really good on the first one. You say, I'm going to take it again. Take it 3 times. Why not? Take it 3 times. It's going to give you, 1, repetitiveness of looking at those words. And then I love this background because it's all blurry. That's kind of cool. So it doesn't show the mess of my office. There's a picture right here. And that's a bookcase, which has a bunch of junk in it, and my coat and my door. So anyway, take it 3 times. It's not, just do it like that. It's going to take you, Each one, if you just ran through and took it once, read the questions quickly, go through and get what's your first intuition on it. Boom, 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 boom. Oh, you got 6 out of 10? Sweet. You know that you're at least a 6 out of 10 just from a standstill. Now, read through them again. Read through them, go like, huh, okay, let me think about that. Okay, oh, I know that word better. Okay, wait, I know this one. Okay, I did that. Now you got 80%, 8 out of 10. Now go back again. Go back again. Look a couple up. Like, okay, I looked through this. Oh, crap. That's what that means. Now I can put that correct answer. You get 100 out of 100, or 10 out of 10, whatever it is. Okay. This is the easy A for the class, guys. I mean, you can get it, and it can raise the rest of your class if you're having troubles with like the labs, because the labs can be kind of subjective, which means like, all on you. The assignments, kind of the same thing. I mean, there's a lot of leeway. You can goof things up pretty easy. That happens sometimes. Discussion boards, unless you're not responding to people or you're responding kind of vaguely, remember, and you guys are doing so well on this, so I'm so proud of you for doing like the awesome, hey, you're not saying like, I agree, and leaving it at that. That's terrible. It drives me nuts. I mean, it drives me crazy. But you guys are going like, I agree, and blah, 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 blah. Okay. Anyway, this is Dr. Sean over at Fortis Online Colleges. It's 31 minutes, I think. Where's my timer? 33 minutes. And we're going to end it here. I'll be on again later on this week. You guys do your homework, do your things. If you have a problem, let me know in the Canvas section, you guys. Okay. So I'm going to do some emails today and contact you because let's see. Oh my God. I've got, let's see, 1, 2, 3, 4, 5 of you guys are like that close to 100% in the class. That close. 2 points, 3 points, something like that. And I'll contact you guys because you deserve a thumbs up. I really can't say like, hey, Joe Schmo got 99.7 because then people will go crazy because I'm giving information. But we won't do that. But I want to like give you guys kind of a little thumbs up because I think I'm so proud of you because this can be a hard class. All these online classes are a pain in your tuchus. They're hard to do. You have to be organized. I know because my stepdaughter right now is going through real life classes in high school, and she went through all the online stuff. So she got so used to that. It's hard for her to do other stuff because you can wake up in the middle of the night and go like, oh, I got to do assignment 4 and do that thing. Right. So this way you have to be on top of things easier than in real life, because in real life you show up at class and go like, what day is it? It's Wednesday. Oh crap, that thing's due. I didn't do it. Let me try to do it right now or whatever. It's late. Okay. So this is a little bit more leeway in a weird way. Okay. So it's a little bit more forgiving in some ways, less forgiving in others. You have to be a little bit organized, but just check in with the system all the time. And that will help you out. Okay. See you later. Take good care. Take your vitamins, eat your vegetables, get your sleep, wash your butt, all that stuff. Anyway, have a good time. We'll talk to you guys later. I'm going to post this on YouTube today. Okay. See you later. Bye.